Jim Vance, 38, end-stage kidney failure, suffered a syncopal episode following dialysis.
Transplant candidate?
Too far down the list. Hi, Mr. Vance. This is Dr. Halstead.
Heard you had some trouble today.
Today, Tuesday, last Friday, almost every time I get dialysis now.
What happens?
My chest starts to flutter. I feel really weak. Ventricular...
Ectopy.
Ectopy.
Maybe IDH.
Intradialytic hypotension. In some people, dialysis can cause an extreme drop in blood pressure, which prevents enough oxygen from reaching the heart. And over time, that can cause dysrhythmias or even a heart attack.
So tell the transplant people, maybe they can move me up the list.
Well, we can try, but I'm sorry to say heart disease usually moves people down the list, not up.
But I'm not even 40 yet.
I hear you. And I promise we're gonna do everything we can to help.
Yeah.
Let's get him on 15 PO of Caxolate and start him on esmolol to stabilize his rhythm.
Or we could do low-volume dialysis.
We could?
Otherwise, we're just treating the symptoms and not the actual problem.
Yeah.
Great.
Okay.
I'll be back in a few.
We'll see you. Natalie. We don't usually disagree in front of a patient.
I had to say something.
You really think low-volume dialysis will make a difference? I mean, it seems like 6 to 1, half a dozen the other, no?
I don't know. Maybe. Let's find out.
I love my brother. I'd love to give him my kidney.
Well, what's stopping you?
I'm HIV positive.
But giving him a kidney would be giving him HIV as well.
I'm guessing by his reaction that he doesn't know.
Not a clue.
May I ask, why don't you tell him?
Because Jim is incredibly homophobic. He thinks homosexuality is disgusting, deviant behavior.
Yeah, but right now he thinks you're willing to let him die.
Right now, he hates me for what I'm doing. And if I tell him this, he'll hate me for who I am.
I understand. But just so you know, if you don't tell him soon, it may be too late.
He's in VTAC. Stop the dialysis.
Pulse is threatening. Shortness of breath.
Lost his pulse. We gotta defibrillate now. Bag him.
Give me the paddles.
What's going
Charge
on?
to 200.
He's in cardiac arrest.
Clear.
Still in VTAC.
On charge to 300.
Sinus rhythm.
Jim, can you hear me?
He's stable for now.
Jim, I need to talk to you. I gotta tell you something.
Given your latest reaction, I'd like to try something different. A medication called midodrine to raise your blood pressure, followed by a special course of low-calcium dialysate.
Will it work?
But to be honest, it's a long shot, but it's our best option.
Just tell me. How long have I got?
You're experiencing cardiac events with every dialysis, and you need dialysis 3 days a week, so realistically, it can happen at any time.
We are trying everything we have.
Wait. You wouldn't give me a kidney because of the virus, right? But what if I don't care? Would you give it to me then?
But you'll get infected.
HIV is better than dying. Would you do it?
Yeah, of course.
Then let's do that. I want his kidney.
Mr. Vance, you are severely immunocompromised. If you received an HIV-positive organ, if you contracted HIV in any way, it could immediately progress to AIDS, and that would most likely kill you.
Wait. Let's just do it.
As your doctor, I strongly...
Will you excuse us for a moment? Thank you. We should look into this.
Look into what? Purposely giving someone HIV?
He knows the risks. What does he have, days, a couple of weeks?
That's the thing, we don't know. He could surprise us and make it long enough to get a healthy kidney. We could put him on carnitine, try sodium modeling.
He's grasping at straws. Yes, a transplant is dangerous, but if it works, it could give him years.
It's unethical and illegal. Even if you found a surgeon willing to do it, the minute anyone found out, our licenses would be revoked.
So we get a special dispensation. That man is dying in there. The least we could do is give him a chance.
Natalie, I'm sorry. As the attending physician, I cannot sign off on this.
Fine. I'll figure it out myself. Mr. Vance, I'm afraid that as things stand, there is no possible way you can receive your brother's kidney.
And so there's nothing at all that we can do?
Not as things currently stand.
Even though I know the risk. Even though I want to do it.
That's correct. It is illegal to give an infected organ to a non-infected recipient.
Oh, that's a terrible irony, because if you already had HIV, the procedure would be legal.
Now, obviously, we can't give you HIV.
No, but he can. And you do have a choice.